Annalise Robinson was only 7 years old when she was diagnosed with osteosarcoma in her right tibia. She had an operation done called a rotationplasty, and she received chemotherapy for 10 weeks before this operation and 20 weeks after. It took 1 year to heal from her surgery, and during that time she received her prosthetic. She enjoys playing sports like softball, and she enjoys playing in the orchestra, and with the surgery she can still enjoy doing them things. At age 10, she can now walk on her own, and she is learning to run on her own. Although there are few orthopedic surgeons that are trained to perform these operations, they are still very successful. I will be telling you about what a rotationplasty is, why they are performed, the pros, the cons, the risks, and the recovery time after the surgery. First, let me tell you about what a rotationplasty is and why they are performed. A rotationplasty is a partial amputation of the lower femur, the knee joint, and the upper tibia. The ankle is rotated at a 180-degree angle, and the ankle is replaced as your knee joint. Rotationplasties are used to treat osteosarcoma and Ewing sarcoma in the knee, and they are often performed on younger children because their bones continue growing and their brain adapts better to the change. What are the pros, the cons, and the risk of having the surgery? Some of the pros are after the surgery you are allowed full function of your knee. You have no faintal pain because the nerves in your leg are not cut. And the bones continue to grow after the surgery, and prosthetics can be lengthened as the patient grows. Some cons are the unusual look because you now have your ankle and your foot attached to where your knee joint used to be. Lots of rehab is required, and there are very few orthopedics that are actually trained to give this operation in the United States. Some of the risks include bleeding and blood clots, infections, and nerve injury, although the nerves are not cut. Now let's look at the recovery time that happens after surgery. After surgery, there is at least a 1-week stay in a hospital, and a wheelchair and crutches are used until the bone is fully healed and the prosthetic is available. A cast is worn for 6 to 12 weeks or until the bone heals, and if the patient is receiving chemotherapy, the healing may take a little bit longer. As you have heard about what a rotationplasty is, why they are performed, the pros, the cons, and the risks, and the recovery time after surgery, you now know that rotationplasties are very successful and they are very necessary. Thank you for listening.